Hi everyone, it's Dr. Nonnie here. So nice to see you all. I just want to say a big thank you to those of you who have been subscribing to my channel. It's really nice to, hear your comments and all the feedback you send me, and also your requests for what you would like me to teach you next, because I am a family physician, your friendly family physician, I like to call myself, and I also like to teach. So I'm an associate professor at the University of Saskatchewan, and I teach when I'm in the UK as well. Well, when I was in the UK, I've moved to Canada mostly. And today I brought you someone else so you can learn from someone else as well. So my guest is all the way from Canada, Dr. Adam Bell. Please join me in welcoming him.
Hi.
Yeah, yeah. So Dr. Adam Bell is a doctor of chiropractic, and he's also a very clever man because his bio is very impressive. He graduated in well, quite recently. I wouldn't say when, so we don't give away his age. I know he looks very young, so just imagine. Yeah, Adam, are you okay with sound? Yeah, yeah. I can hear you. So yeah. So it
Okay,
just you
so
said no, that's okay. That's
Bluetooth.
the thing with all this with technology, isn't it? Sometimes it's your friend and sometimes not so.
Absolutely.
Yes, I was just introducing you, Dr. Bell. I was just saying how clever you are because you graduated summa cum laude in your
Mm,
set in University of Western University in Oregon, isn't it? Portland, Oregon. And
that's
then
correct.
you and your wife moved back from the States back home. I think it was to Saskatchewan and Saskatoon. Yes.
Yeah.
Yes, and that was actually you guys moved back about the same time as I moved to Canada. So we have that in common. We all came in during the pandemic when we're all masking up and all that. And I know you and your lovely wife have since settled in Canada and you're still there, unlike me who's run away for the winter. So you're
hmm
braving it out. Yeah,
Absolutely.
so yeah, and then apart from Adam being a doctor of chiropractic, he's also has two bachelors of science. I was quite impressed, Adam. You've been studying, haven't you? One from the
Little.
University, one from the University of Saskatchewan, the other one from the University of Western, the Western University as well in Oregon. So welcome, Dr. Bell.
Hey, thank you so much. I'm happy to be here. It's always lovely
Good.
chat.
Good. So you remember, I don't know if you remember our first meeting, but I don't think you can ever forget how I grilled you. I was like, what is a chiropractor? What are you doing? How are you going to help me with all my aches and pains? Which you'll be
Absolutely.
happy to hear. I'm much better. I'm now able to jog since I got back to the UK. So I'm
Well,
doing better.
sure.
Yeah. Good. So Adam is actually he's also my chiropractor. I was recommended to see him for his expertise in musculoskeletal problems. Now, as GPs, family physicians, a lot of the people that we see are complaining of back pain, neck pain, arm pain, pain everywhere. And then one of the good things about Canada is like, unlike in the UK, where we have the National Health Service, where everything has to go through the GP, though they're trying to change that now. In Canada, you can go on your own and just go and see a physiotherapist or chiropractor. And this is why I was recommended to see Adam, because as you know, it's going to be winter soon, a lot of shoveling, a lot of ice skating, lots of winter skiing, winter sports, people falling down, injuries. So they will need to see someone like you. So tell us, Adam, in your own words, what is a chiropractor?
Well, I mean, in the easiest, most basic way of explaining it is what we do is we help deal with individuals who are experiencing pain, usually from the musculoskeletal point of view. And we do everything that we can to basically find out what's going on. And we do that through taking a thorough history as well as performing a thorough physical exam. And then once we've come to diagnosis or what we think is going on, then what we're going to do is we're going to help you get out of pain, whether it's through doing spinal adjustments, which is something that chiropractors do, as well as other practitioners too. We also do give some dietary advice. We can also give
Mm-hmm.
lifestyle modification. We tell you how to set up your office at work. I mean, and like during COVID times, how to set up your kind of setup at home just to help prevent all of those aches and pains from coming on day. So yeah, it's just a way of helping to basically get the body moving in places that it's been stuck for probably quite a while, especially if it's your first time.
Yeah, I mean, I'm glad you said that because I thought I was fairly good at being active. It's only when
Mm-hmm.
I saw you on my physio, I realized actually I had some joints and muscles which were really stuck, and releasing them was so much, by the time you guys did the release, I really felt better. So I, as a UK trained GP, we do not even recommend chiropractor. We don't even know what you guys do. And I remember giving you a little bit of grief that how are you
Oh,
going to help me?
no, I love a little bit of a challenge. I'm a dialogue because that's something that's needed because right now, as we've all in your profession, my profession, we can see that there's a big kind of a lapse in care of people, especially with dealing with low back pain.
And how much time is lost, isn't it? But from the employer's perspective, because they can't, the employee can't come to work because of one pain or the other. So it's really important. So I mean, tell me common things. I know you mentioned musculoskeletal, but you mentioned low back pain. What else do you sort of see commonly?
I mean, yeah, low back pain is pretty common. One thing that we deal with a lot, especially with how society's gone nowadays, with where the amount of office jobs, sitting, all these extra forces sitting in this flexion, the amount of we get that head going forward, we start dealing with those tension headaches, chronic neck pain, start dealing with the shoulders going forward, causing that pain between the shoulders feel on a daily basis. It's all those like when it comes to what we do, the postures that we take during the day, it's creates a really big toll on the body if we're not in good ones, and especially if we stay in there.
Right, right. If I was talking now, I can feel myself trying to adjust, making sure that I'm remembering all your advice as well. So, I mean, in the UK, we don't really have chiropractors. We have osteopaths. Are they the same thing? Could you just tell us?
So that's actually a really good question because it's actually quite complicated depending where you are. I did have to do a little bit of research because I couldn't answer completely at first. So it actually depends where you are in the world. So more in the UK, Europe, those kind of things. Yeah, with osteopaths, they are basically what they do is they look at the body as a whole, while chiropractors we focus more spine, nerves, and out from there. Osteopaths tend to look a lot more kind of widespread, whole body, muscles, basically that whole body encompassing, trying to get everything moving together to make sure the body's feeling better. So it's very, very, very closely related to what chiros do.
Right.
Um, we tend to focus a bit more on the spine. But then, yeah, if you're looking into the United States, where the training down there for osteopaths are actually DOs, which is the doctor of osteopathic or an osteopathic physician. So they actually have just as much training as a medical doctor. It takes about 12 years to actually take that position. You have to do 3 years of residency. They also have all of the exact same rights and the scope of practice as a traditional doctor. So you'll find them, they can work pediatrics, you'll find them in emergency situations or emergency settings, you name it. And so yeah, they're the equivalent of a normal doctor. However, in Canada and the UK and that, it's completely different. So it's actually really quite interesting. So it's rare to find doctor, like an osteopathic physician outside of the United States.
Right.
Because of the regulations that go into their schooling there compared to everywhere else. And so everywhere else, they tend to be osteopath, and then they're a manual therapist of osteopath. So that's kind of that dividing line is the osteopathic physician versus the one of manual therapy.
Wow. Okay.
Very
Well, I mean, but thanks for explaining that. I think, that's obviously an eye opener. I didn't realize that in the US they had the D of O, Doctor of Osteopathy. So I mean, this is why we do this interview so people can get knowledge from reliable and trusted health professionals. And then I always like to keep the interviews short so that people don't think, oh my God, it's going on and on and on. But I think I wanted them to know how you got into this path. Maybe just share with us your own story. How did you become a chiropractor?
Yeah, so I knew that I wanted to get into healthcare naturally. My dad's a firefighter, my mom was a registered nurse, so it's kind of in the. And then my younger brother has also suffered from severe epilepsy since he was 2, so I had that I had giver in me, and so yeah, natural place to go. And then I ended up working construction I was working construction all through school, about 7 years off and on, and I ended up kind of throwing out a rib to terms throwing out a rib, and it's like I couldn't shift the vehicle. I was in excruciating pain, 7, 8 hours, and I got a recommendation to go see a chiropractor, and I hadn't done that before. And I think I was 20, probably 22 at the time. I'm 33 now, and yeah, him and basically did a quick little check, felt the back. He's like, "Oh, is it right here?" I'm like, "That's exactly where it hurts." Basically, talked about chiropractic, what it does, adjusted there. had a couple of days of pain, which is extremely natural, especially with ribs. But 3 days later, I was pain-free back at work and back to doing what I wanted to do. It kind of gave me a little bit of a paradigm shift and kind of blew my mind a little bit of what can be accomplished in healthcare. And it kind of set me down that path. Yeah.
Well, I'm glad they did because you certainly help people like me. So if anyone wants to see Dr. Bell, where can they come? Where are you practicing right now? I know you're in Saskatoon, but whereabouts are you?
Yeah, so I'm at Massage Addict in University Heights area. You can find us online, super easy. The nice thing is too, we also do bookings online, which is pretty commonplace nowadays. You can also at 306-986-5866, and our lovely front staff would be more than willing to help anyone out and then kind of pass you down the line through me. And then we also have massage therapists and we have acupuncturists. And yeah, we kind of have everything in place to basically get people doing what they want to do. And that's the biggest thing.
Yes, I think that's so because nowadays, like, people want to be young forever. People still want to go skiing. They still want to be able to do their sports. And, the injuries do set us back, isn't it? So, I mean, for me, I'm so happy that when I got back and I was able to jog again, I was the happiest I've been for a long time. I was like, yes, I'm back. And it just gives you so much joy to be able to do that. So I really want to say thank you to you and your colleagues. I think I've seen quite a number of you at the Massage Addict for your help to me personally. And I'm sure that, we'll be sharing your details in the description. And so we have to end this interview now. So Adam can get on with his job of helping people and I can get on with mine. But please, 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 if you've enjoyed this video, I'll really appreciate it. I'm sure Adam will. If you give us the like button, and then if you share it and if you subscribe, because we're not getting paid, I'm not paying you for this, Adam. You're not paying me either to put out the word about your clinic. But the subscription just is free for you, the YouTube account holder, and it just gives us that little boost that yes, we've helped someone extra. And so till next time, is Dr. Nonnie and Dr. Bell. We're saying goodbye. Thank you for listening.
Yeah, thanks for listening.
Bye.
That I've gotta make a change. I don't care if I break, at least I'll be feeling something. Just okay, it's not enough. Help me fight through it.